mentioned thermography.
Yes.
Are those superior to mammograms, which is the typical way that we measure, that we detect breast cancer?
Well, let's start with mammograms. Again, by the time they see a lump on a mammogram, it's taken 5 to 8 years to develop. And if a woman follows the 10-year protocol of getting a mammogram every year or every 6 months, she is getting as much radiation as a woman had at Hiroshima, the atomic bomb, if she stood a mile away from the epicenter. She's getting over 5 rads of radiation in a mammogram if she follows the traditional methods of mammography. So mammograms cause a lot of problems. The compression, the radiation, the studies have shown that they can increase your risk of cancer. And the newest study that came out in Canada, it was a 25-year study where they found that mammograms did not decrease breast mortality rate at all. In fact, they were just as effective as a self-breast exam that women do. So if we put mammograms aside and we look at the technology with thermography, which has been around for years and can detect physiological changes at a very early stage, wouldn't you rather know that there's possibly some changes going on in your breast or in your abdomen 5 to 8 years before you have a diagnosis? And with thermography, there's no pain, there's no compression, there's no radiation. It's just a beautiful tool to have in your pocket.
Beginning back to the women's health now, it would be a sort of a tragedy having you on the interview and not having you review, or at least put in proper context, the importance of proper breast self-examination. You know, how important do you think that is? How regularly should it be done? And then maybe you can give some description or explanation of how that should be done.
Well, the truth is that there was a huge study done in China that showed that in teaching women, factory women, how to examine their breasts did not decrease their mortality at all. In fact, all it did was increase the number of biopsies for benign disease. So there's no data that breast self-exam helps with anything. So let me do a complete 1/4 turn on this. I recommend a monthly or weekly self-love breast massage, not to find something, because here's how breast exam is taught. Make your hands into 2 minesweepers and then touch your breast to find something that may kill you. This is why women don't do it. But imagine, maybe with your Epsom salt bath or your self-loving shower, you rub your hands together, create a nice energy field, which we could measure with the right tools. And then you lovingly, I would start here. The tail of Spence is this part of the breast up under the axilla, up under the armpit. This is where all the lymph nodes are. And just massage this with love. Massage this with love. You're not looking for anything. Let me tell you something. The average woman will find something. We know that breast self-exam, or just a woman finding something because she knows her breasts, is just as good as all this other screening stuff for finding the fast-growing tumors. See, the problem with screening is it finds the slow-growing ones that may regress or wouldn't go anywhere anyway. So, for a part of your health, you want to start a practice of bringing your breasts home to your chest. I had a patient once, she says, my breasts are being taken care of at the Leahy Clinic. Good clinic. I said, my breasts are being taken care of on my chest. So I want you to take care of your breasts on your chest, lovingly get to know them in health, lovingly. Don't use your fingertips, by the way. Use this part, use this part. Otherwise, you're going to feel every little gland and freak out. So this part, until you know what's there normally. And then if you do find that you have what's called fibrocystic disease, where your breasts get tender, start eating some kelp tablets, because the iodine really helps that in a huge way. So that's how you're going to do it. You're just going to do lovingly getting to know your breasts, and maybe have a little sign, time for breast love. And you can do that once a month. With women, the best time to do it is just after your period. when you had the least amount of hormonal stimulation. So you just get to know. Remember that the breasts in ovulating women follow the same pattern as your ovaries, and your ovaries follow the phases of the moon. So you might want to get in touch with that universal energy that is influencing the flow of fluids in your body. You're part of that bigger picture, and that's pretty wonderful. Get it out of the category of minesweeper. That's just the wrong energy to bring to it. And by the law of attraction, the more we look for something wrong, the more we find, which is why it's better to start looking for what's going right.